The journey towards addressing the HIV epidemic requires not only awareness but also a pivot to power. Journey with me as we discuss the historical context of HIV, the impact of the epidemic, influential individuals who have significantly contributed to the field, various perspectives surrounding the issue, and potential future developments in tackling HIV. The HIV epidemic emerged in the late 20th century and has since evolved into a global health crisis. Initially framed as a disease affecting marginalized populations, misconceptions and stigmatization hindered early responses. The societal reaction was often shrouded in fear and ignorance. Activism played a critical role in reshaping the discourse surrounding HIV. Notable activist groups, such as ACT UP, highlighted the need for research, treatment access, and policy change, fundamentally altering the narrative from victimization to empowerment. Their advocacy not only brought attention to the plight of those living with HIV but also compelled governments and pharmaceutical companies to prioritize research and access to treatment. A significant figure in this pivot was Dr. Anthony Fauci, who has been at the forefront of HIV/AIDS research and policy throughout the epidemic. His leadership at the National Institute of Allergy and Infectious Diseases helped shape public health responses to HIV, promoting a scientific approach to treatment and prevention. Moreover, his emphasis on the importance of community engagement set a precedent for future research initiatives, demonstrating that patient voices are vital in shaping effective health policies. The impact of HIV extends beyond the individual experience. It affects families, communities, and healthcare systems. Stigma continues to be one of the most significant barriers in combating the epidemic. Many living with HIV face discrimination, limiting their willingness to seek treatment or disclose their status. This stigma not only hampers individual health outcomes but also affects public health initiatives. Addressing stigma must be integral to any strategy aimed at pivoting power towards effective HIV management. In recent years, advancements in treatment, such as antiretroviral therapy, have transformed HIV from a fatal diagnosis to a manageable chronic condition. However, access to these life-saving medications remains uneven. Populations who are marginalized, such as people of color, the LGBTQ+ community, and those living in poverty, experience higher rates of infection and lower access to care. Policy reforms are essential to ensure equitable access to treatment and to dismantle systemic barriers that perpetuate health disparities. Recent developments in prevention strategies also provide hope in pivoting power against HIV. Pre-exposure prophylaxis, or PrEP, is a medication taken by HIV-negative individuals to reduce their risk of infection. This preventative measure empowers individuals with more control over their sexual health. However, awareness and access to PrEP remain significant challenges, particularly among underserved communities. Community-based organizations play a critical role in educating at-risk populations about these options, which helps to shift the power dynamics in favor of those at risk of HIV. While discussing perspectives, it is essential to consider the voices of those directly affected by HIV. Patient advocacy groups emphasize the need for inclusive policies that reflect the lived experiences of people with HIV. Their insistence on being part of the decision-making process in health policy development represents a shift in power dynamics, advocating for rights and dignified treatment. Internationally, the HIV epidemic reflects various geopolitical landscapes. In lower-income countries, particularly in sub-Saharan Africa, the challenges are compounded by limited resources, health infrastructure, and ongoing political instability. The Global Fund and UNAIDS have made strides in funding and mobilizing resources to tackle the epidemic in these regions, but continued financial support and commitment are crucial. Looking ahead, several potential developments may influence the fight against HIV. The ongoing research into a potential vaccine represents a significant goal within the scientific community. While the road to a vaccine has been fraught with challenges, continued funding and innovation could eventually lead to breakthroughs. Additionally, the integration of HIV testing and treatment into general healthcare systems represents a critical pivot towards ensuring universal health coverage includes HIV services. Technological advancements also hold promise for the future. Telemedicine and digital health tools can enhance access to care for those who might otherwise face barriers in traditional healthcare settings. Utilizing technology can help bridge the gap between patients and healthcare providers, enabling remote consultations and follow-up, particularly in marginalized communities. In conclusion, pivoting to power regarding HIV requires a multifaceted approach. It involves a commitment to dismantling stigma, promoting equitable access to treatment, and amplifying the voices of those affected. Historical context highlights the role of activism and influential individuals in reshaping the response to HIV, but the ongoing impact of the epidemic necessitates a collective effort that acknowledges the complexities of health disparities. As the landscape of HIV treatment and prevention continues to evolve, it is vital to harness these advancements responsibly, champion social justice, and ensure that all individuals have the tools and resources to manage their health effectively. 10 Down WJ, where creativity meets impact. 10 Down WJ, E, N, T.